cities and municipalities from around the state for your partnership, for your responsible behavior, for so many good things that have allowed us to steer through this pandemic. It's been an incredible 3 months for all of us. There's more to do, but we're heading in the right direction, and it's a tribute and testament to the good citizens and the common sense that I see everywhere around the state every day, and I'm grateful. Our approach is going to remain calm and steady. We're going to take urgent action when it comes to public health. Now in Arizona, our timing has been later because our situation has been different than what you're seeing in other states, and it will continue to be focused 100% on the state of Arizona. And if we have a situation in a county or a hot spot, we will deal with that directly. And we're going to continue to have our decisions informed by data and public health. This is the White House gating criteria. Centers for Disease Control, along with the federal partners, put this together. It's the symptoms, cases, and hospitals. This is the same information that every governor in the country has been given. There's flexibility provided. You can act statewide or county by county. I'm going to take you through Arizona's numbers. On our symptoms, we're looking for a downward trajectory of influenza-like illnesses within a 14-day period and a downward trajectory of COVID-like cases within a 14-day period. This is Arizona's chart. The blue line is COVID-like illnesses. This is since December 29th. The gold line is influenza-like illnesses since December 29th. If you see the vertical line, about 2/3 to the side, that's when we put the stay home, stay healthy, stay connected order. You can see the downward trajectory in both COVID-like illness and influenza-like illness. You see in this last week a slight uptick in the flu-like symptoms from 1.5% to 1.55, just something to be aware of. Cases, a downward trajectory of documented cases within a 14-day period, or downward trajectory of positive test as a percent of total test within a 14-day period. Here are our cases by day, beginning with the day that the public health emergency was declared on March 11th. If you take a look at this chart, you can possibly see the beginning of a downward trend. The trend is not here yet, and we do fill these in over the last 4 to 7 days because the information hasn't yet been reported, but you can see these lines getting a little shorter, and this is something that we'll continue to monitor. Percentage of positive tests. Now, there was some misunderstanding around the tests. These are 100% PCR tests or diagnostic tests. There's no antibody test mixed in here, no serology tests. These are all diagnostic tests. The blue graph represents the testing blitz. You can see the increase in testing since we began the blitz on April 12th. And the gold line represents the percentage of positive tests. You see the 5 straight weeks of a decrease in terms of positivity, meaning the contraction of people that have COVID-19. You can see the last 2 weeks from 5.1% to 6% and 6% to 8%. So again, we're testing a lot more folks. We're having a testing blitz. We're down significantly from our high, but we want to see that line continue to go down. That's the trajectory that we want to see. Let's talk about hospital capacity. This is really how we measure not only who has contracted COVID-19, but who is sick and needs care and comfort. The gray in this graph represents availability. The blue represents inpatient beds that are in use, and the gold represents beds that are being used for COVID-19 patients. If you can see across the course of time, beginning on April 10th, that line remains pretty steady, pretty flat, somewhere between 10 and 13% of available beds. The takeaway is we have capacity of hospital beds if necessary. Intensive care unit beds, this is if you're extremely sick. Gray is availability, blue is ICU beds in use, and the gold is ICU beds with COVID patients. You can see the same, you see a slight uptick on May 24th and May 26th, but we're pretty much between 11 or 17 and 20% of available beds here throughout. Ventilators, we have a lot of availability. We have some ventilators in use, and our COVID use for patients with ventilators is pretty flat, consistent, and steady. The takeaway on ICU and ventilators is that we have capacity. If there were to be a spike in the state of Arizona, we are prepared with medical capacity. Testing. We want to have a robust testing program in place for our healthcare workers, including antibody testing and trace contacts of COVID-19 results. If you take a look at our testing blitz, began on April 27th. We've done a total of over 287,000 tests combined. That is over 200,000 diagnostic tests. That's the PCR test, the test that tells you if you are sick today. The other tests that we're applying are the antibody or serology tests. Those tell you if you've contracted COVID-19 and have since recovered. We're going to continue our testing blitz. We're focused on people that are symptomatic. People believe that they've contracted COVID-19 or have been exposed to it. We want to focus on where folks are most vulnerable. Our long-term care facilities, congregate care, assisted living, and state prisons. So I'm joined today on my left by Major General Mick McGuire, who leads up the National Guard and our effort at DEMA, and Dr. Kara Christ, who's the Director of Arizona Health Services, and she's going to take us through where we are regarding those objectives. So, Dr. Christ, welcome and take it away.
Thank you, Governor. So we continue to work on those populations and those areas that have been considered priorities. So we are currently in the process of testing residents and staffs in all of the Medicare certified skilled nursing facilities, and we are working to ramp up the testing in our assisted living facilities. So there's approximately 147 Medicare certified skilled nursing facilities, and there's about 2,300 assisted living facilities statewide. We're also working on getting our correctional officers access to serology testing, so that's the antibody testing. We continue to provide support to Navajo Nation, and then we're continuing to monitor some increasing numbers that we are watching in Yuma County. And so there are a couple of different things that are going on in Yuma County. We continue to provide support and testing for individuals and populations down there. One of the things that Arizona has done in preparation to ensure that we have ongoing hospital capacity is we established the Arizona Surge Line, and we're one of the only states to have this free 24/7 centralized call-in line for hospitals and their providers that they can call if they've got patients that either need to be at a different level of care, either higher or lower, or a hospital becomes is concerned about their capacity or their ability to care for that patient. This was stood up in April. Over the last few weeks since it's been stood up, we have facilitated the transfers of over 400 patients statewide to the appropriate level of care. This is a real-time call that a hospital just has to make one call, and this line can find where the available beds are, where the available care is, and actually facilitate that transfer, taking that off of the hospital's responsibility so that they can go back to caring for other patients. There's an executive order that that will be released that requires the hospitals to actually utilize this. This actually was a partnership that we worked with the hospitals on. They voluntarily have been working on that and have provided resources to help assist the state stand this up. What it does do is it does require more frequent reporting of those beds so that we have a good idea of what's currently available when we need to find it. And then it will require them to accept patients when it's clinically appropriate and when their resources allow. The other thing that it does is it ensures that the patients who are transferred by no choice of their own because the surge line is coordinating their transfer, that it will be considered in network by their insurance provider, because the last thing we want is for somebody to get transferred to a hospital that's out of network and have a large insurance bill. Thank you.
Thank you very much, Doctor. And now I want to turn it over to Major General Mick McGuire, and I want to thank him for his hard work, his double duty as leading the National Guard and taking over the DEMA effort as well, and talk to us about what's going on in Navajo Nation and the situation with supplies and PPE.
Yes, sir. Thanks, Governor. Appreciate the continued support. I want to first say that we're continuing our efforts to support not just Navajo Nation, but all the tribes we've, in the last week since we last met, have been able to send out some PPE training teams from our Task Force Med to Hopi Nation as well as White Mountain Apache Tribe, as they have also unfortunately had some cases on their tribal lands. We continue to provide Task Force Aviation Support. Dovetailing on what Dr. Chris said, our UH-60 Blackhawks are part of that response network for the very remote areas of the country if we need to do transfer for certain patients based on criteria that we've established with health services. So we're proud to partner with them in that regard. And we are actively working with our federal partners and other volunteer organizations to provide staffing, and we have both of the 50-bed alternate care sites operating now in Chinle and Shiprock. As we go forward, we'll continue to maintain that presence, and we're thankful that not only the Guardsmen are supporting the folks on Navajo Nation, but all of the state. President Trump announced today that they'll continue to support that effort on Title 32 502F through mid-August, which I know was a national story recently. So we're thankful for his advocacy and the support of the governor as our Commander-in-Chief to continue that. As we work our way around, we still have the humanitarian mission going with the water tanks. We are post-mobilizing 3 of the 4 of them. The Navajo Nation has things under control in that regard, and we're continuing to monitor the situation there. We have a lot of outpouring of public support and donations, and we are able to execute just in the last week 4 specific missions from the food banks down in Santa Cruz County that have excess produce to move that equipment with our Guard Task Force Logistics and that food and supplies up to the northeastern part of the state. And finally, I would say, as we look at that trucking mission, the governor mentioned the PPE. We have a picture here of the past weekend. Fitting on Memorial Day, we were able to put a mutual aid request in with the state of California in coordination with Dr. Chris' staff. She has 5 folks that they've put on since this has started over in that warehouse, and that warehouse is relatively empty. On Sunday and Monday, we sent 13 trucks out to California. We're able to deliver 10 million surgical masks 50,000 face shields filled up the entire place. And with the help of just 16 of our guardsmen and women that are there permanently assigned on 2 shifts and Dr. Chris' team, we were able to turn all that equipment around in less than 48 hours and deliver it to all 15 counties. And I can say, as the emergency manager and the commander of the Guard, there's a huge logistical effort to empty that warehouse. 13 full truckloads of stuff, repackaged, sent to all 15 counties, and I feel confident that we've gotten out ahead, at least on the surgical mask issue. We received 25,000 last week as well from Honeywell and their initial N95s. We're still continuing to work resourcing the gown issue, and I'm confident that our local Arizona economy will help us overcome that, sir. Thanks.
Thanks very much, General McGuire. Thank you to the brave men and women of the National Guard and the coordination that you've shown with the Department of Health Services. Just been an incredible team effort. So let's talk about where Arizona is today. Of course, we're going to return the Arizona way, focused on our state 100%. Our announcements will be gradual and phased in as we come out of this pandemic. We're going to balance public health with returning stronger and believe we can do both safely and successfully. We're going to increase testing, and we're going to maintain strong physical distancing. Again, I want to thank the citizens for their responsible behavior that continues. And we're going to base the recommendations of CDC and health experts as we make decisions over the next several weeks. So I was able to meet with school leaders and superintendents from around the state earlier this week. I want to thank these people. Our hardworking teachers, principals, and superintendents really we all had a curveball that came at us in March. They did, especially because they were in the middle of the school year. They switched almost immediately to distance learning. There were all hands on deck. There was a surge of supplies and hot spots and technology. And by and large, they've finished out this school year or are completing it very soon. And we got together to talk about what's next. What does next year look like and the next school year? So I want to thank Superintendent Kathy Hoffman, who's been a partner and a leader throughout this in looking out for Arizona school children and what's in their best interest and how do we work with educators and teachers. We did a lot of listening in this meeting. We received a lot of input from leaders across the state. I would say the good news was no matter where somebody was or what their role was in the system, they were eager to get back inside a classroom, to get to the front of a classroom. So they're looking for clear guidance. Flexibility was the coin of the realm so that we could tailor guidance to meet the needs of the specific school district and the situation that we still have in the state of Arizona. The announcement today is that schools will resume at the start of this school year. We're planning ahead. Superintendent Hoffman will release guidance for schools on Monday, June 1st. This guidance has been informed, of course, by school leaders, teachers, parents, and public health experts from the Arizona Department of Health Services. In addition, we're going to have an executive order to support our schools. The superintendent's asked for flexibility around child care ratios for school-based child care programs. So we're announcing a responsible plan developed by health services that will protect children in school-based child care and will allow for increased child care capacity for school-aged children. We'll continue to work with school leaders to ensure the needs of the children around the state are met. In addition, I said that things would be getting back to normal when somebody could say play ball or batter up. I was hoping that play ball was for the Arizona Diamondbacks, but in the meantime, it can be for Little League. Organized youth activities can resume. So whether that's summer leagues, summer schools, or day camps, Those are important. We wanted to provide clarity here. There is guidance to allow youth sports to resume safely and responsibly, so please feel free. Let's talk a little bit about returning stronger in our economy. Part of that is taking care of the 500,000 plus individuals who were displaced during COVID-19, the people that were working just a few months before and all of a sudden had no income and no job. We've worked hard to make sure that no one fell through the cracks and that our social safety net was strengthened and expanded. This is the unemployment benefits paid, and you can see the first real date where there was an increase was April 4th, just not that long ago. Over $1.4 billion that's been put forward in just a few months. That's over $983 million in unemployment benefits. In terms of pandemic unemployment assistance, those are individuals that in the past would not have been covered in a situation like this. Over $513 million put forward, and you can see the overwhelming majority of that over just the last 2 weeks. I want to say thank you to the hardworking men and women in the Department of Economic Security. We continue to make progress. This week alone, we've paid out over $188 million in unemployment insurance benefits and $218 million in pandemic unemployment assistance. DES has served over 700,000 Arizonans. 572,000 plus with unemployment benefits and 139,000 plus with the unemployment assistance for the pandemic. I know that there have been complaints, and I know that there have been frustrations, and we've worked hard to expand capacity, resources, servers, employees that are working there. They work through the weekend, Sunday and Monday of Memorial Day, but over 700,000 Arizonans have been served. There are more that need to be served, and we will work to do that and to get this right, but I want to recognize their effort because it has been extraordinary. We're also going to announce a new director of the Department of Economic Security today. His name is Michael Weishart. He's a career public servant, started his career 20 years ago at the Department of Economic Security. He has his undergraduate degree from Arizona State University and his MBA from Arizona State University. He's been instrumental inside the agency in the creation of the Department of Child Safety. He led the effort on Arizona's Second Chance Centers, our enrichment centers for child care for essential workers. Michael has been at the Department of Economic Security for 20 years. He has never seen a director promoted from within the agency. To our knowledge, he is the first director to be promoted from within the agency, and we have confidence that no one knows this agency better than Michael Weishart and that he will serve the people of Arizona well going forward. I also want to give a special thank you to Tom Betlak, who came out of retirement to take the lead at the Department of Economic Security in the most stressful, high-pressure time in the history of the state. He's an incredible public servant. It's when the state needed him most, he answered the call. He's also committed to providing assistance and counsel to Director Weishart through this transition. I'm thankful to Tom Betlak for everything he's done for the good people of Arizona, and I'm also thankful that he's going to help Michael Weishart with the onboarding to the leadership role at the Department of Economic Security. I want to talk about our local communities. We were able to meet with mayors and supervisors from around the state yesterday. The federal government has forwarded dollars to the state to not only support the state, but our local communities. I wanted to listen to the people on the front lines, and that's our mayors and our county supervisors in both urban and rural areas. We were able to have a couple of listening sessions with these folks. They told us what was most important to them, and we were able to make an announcement yesterday as to how we were going to disperse these dollars. There's $2.8 billion that was forwarded from the federal government to the state of Arizona. We were able to take these resources to local communities with $441 million for Arizona counties, cities, and towns. These are direct payments. They have maximum flexibility and minimal red tape for our mayors. In addition, we have $150 million in express pay resources. This is going to be Major General Mick McGuire working with local municipality to fast-track FEMA reimbursements for coronavirus-related expenditures. If you look at this $2.8 billion, we've got half of it that has gone out to local governments for their use, what is best and most necessary. I've always believed that the government that governs best is the government that's closest to the citizens, and we've got half the dollars in their hands. And with that, we'll take some questions.
Start here with Howie. Hi, Governor. I appreciate what you're saying about sports, and I've got a question on that in a second for youth sports. But in the meantime, the Prescott Rodeo, the world's oldest rodeo, starts exactly in a month from now. Will they be able to have a rodeo, and will they be able to have people in the stands? Because without people in the stands, they ain't making no money.
Well, I hope everyone can hear the question. The question's the Prescott Rodeo's a month from now, and can they have a rodeo, and can they have people in the stands? The answer is they can have a rodeo. In terms of people in the stands, there will be more to follow on that. Of course, what we want to see today is strong physical distancing, but you're talking about July. That's light years away in the world that we're living in and the change that we've seen in the state of Arizona week to week. So there will be more to follow. But yes, the Cowboys and the Bulls can get ready.
Now, let me just follow up. I just want to follow up. On the issue of youth sports, you said that they'll be able to gather. Again, this isn't like the NBA with the negotiating. What about, again, people in the stands, parents on the sideline screaming? Are they going to be able to have spectators for these youth sports and these summer camp sports?
So in terms of youth sports, of course, the negotiations are complete, and they're ready to have the first opening pitch for Little League. And we're proud of the players and the parents. This idea of physical distancing, responsible behavior is something we're going to continue to talk about. It's going to be important in any of these settings. There's going to be guidance that's put out by the Department of Health Services, but youth sports can resume. And do you want to talk a little bit about the guidance around that, Dr. Christ?
Sure. So there will be recommendations that involve limiting the number of parents or spectators that a child can bring, physically distancing before and after the game, not sharing drinks, snacks after the sports. If there is shared equipment, making sure that you're disinfecting it before and after, so that we do have recommendations that have been developed for our youth activities.
Thank you. Thanks, Howie.
Thank you.
Governor, on reopening of schools, that's firmly in phase 2, and you're not there yet with your testing. That's a big leap to tell the parents of 1.1 million school children that it's safe to go back to schools when we have the most crowded classrooms in the country in this state. That's an anticipatory thing. Why, and you and Dr. Chris can both talk about what are you going to have to pull that back if things don't?
So I want to talk about this decision from a public health perspective. So I'm going to let the public health expert address it. Dr. Chris?
So for schools, we know that we've had daycare or childcare in place where kids have been in a congregate setting. There are a lot of recommendations. When we met with the superintendents of the school, there are multiple plans that they are putting into place so that children or teachers that are at risk can either do distance or virtual learning, that there are opportunities to reduce class size, and that there are disinfecting protocols and a lot of safety things put into place. And this would be very flexible for both the families and the employees of the school district. The thing as a mom that I can't stress enough is that school supplies so much more than education. And so it's important to get these children back into school, back into a normal routine. Of course, it's going to be a new normal. Washing hands, hand sanitizer, physical distancing, not mixing at lunch, not doing big assemblies. And so they will be back to school, but it'll be a new normal.
Go to Stephanie and then Nicole.
I guess this question is for Dr. Chris. So this week, in terms of daily statewide hospitalizations, we saw two larger numbers than usual, 911 on Tuesday and 945 yesterday. Are you concerned about that? I mean, I think to members of the public that can look alarming. So how are you explaining that?
So the data that you're talking about is the self-reported data on the hospital metrics that the hospitals report on inpatient and emergency department rooms. And yes, over the last 2 days, we have seen an increase in the number of COVID-related inpatients, emergency room visits. We will continue to monitor it because it's self-reported a day or two. That may be a reporting issue. What we're going to be looking for is trends in that data over weeks. The encouraging thing to us is that the relative percentage of COVID patients has remained relatively stable over the last few weeks, but we will continue to monitor. We are looking at that data every single day.
Nicole, go ahead.
Governor, thank you for your question. Health data analysts, they cannot replicate your data for a declining trajectory, not even from the own dashboard. You ask the public to trust you, but we're not giving the public a way to verify the data. FEMA says in their May 7th report that Arizona did not meet one of the gating criteria to open, but then you let your order expire 8 days later. Are you cherry picking the data, or are you going to give the public the data to verify it themselves?
Nicole, the data that I put forward is from the Department of Health Services. The guidance that we follow comes from the Centers for Disease Control. FEMA is in charge of supplies, and your information is wrong, and your question is misleading.
FEMA told us that our
FEMA is not
accurate,
does
right?
not set guidance. FEMA does not set guidance. I have a meeting every week with the leader of FEMA, Dr. Deborah Birx, Dr. Anthony Fauci, and Robert Redfield. CDC sets the guidance. Dr. Christ, will you let them know where we are on phase 1, please?
So we do clearly meet the phase 1, or the criteria to be in phase 1. So what FEMA presented in that model was hospital utilization, which is not part of the gating criteria. Of course, it's something that we're monitoring for our resource needs, and we appreciate that FEMA provided the model to us. But for the COVID-like illness and the influenza-like illness, that's calculated a much different way than just the reporting of the beds. And we have clearly met that for quite a while.
I think it said syndromic cases on that as well.
Yeah, and so what we're looking at, syndromic actually is the percentage of those visits. It's a whole algorithm that is used by the Centers for Disease Control and Prevention, and we do meet
Are
that.
we in phase 2 then?
We're in phase 1.
Then how are we talking? Are we talking about schools in person then?
We're in phase 1.
So schools in person?
Go ahead, Billy.
Okay, just real quick on schools, Governor.
Yes.
And for the doctor as well. Did you say that parents who don't feel confident sending the kids back to school, because we know that young people can carry this virus and be asymptomatic and then spread it, parents and teachers that don't feel comfortable sending the kids back to school, is there going to be a virtual option across the state? In other words, if a teacher is over 65, doesn't feel comfortable going back in the classroom with 30 kids running around, they can do that from home?
Thanks very much, Billy. We think that this is important because of where we are today as a state, plus we know so much more about COVID-19 and the virus and who it affects today than we did at the beginning of March. And that was really something that we heard from all of the educators and all of the superintendents. That's why I said that the coin of the realm was flexibility. We're going to have folks that have an underlying health condition that need to be protected, and they won't be able to go back to this temporary normal that we have. So the idea is around flexibility, that we maintain the idea of distance learning where needed, that we do the right things that Dr. Chris talked about in terms of guidance. So it will look different, it will feel different, but the idea is that kids will have a more traditional routine school day where possible and safe. Do you have anything to add to that?
That was perfect.
We'll stay over there. We're going to Craig next. Dr. Chris, thank you for being here today, and Governor, thank you very much in general. On April 29th, Doctor, that you said that if a judge disagreed with your department's decision to withhold information about COVID outbreaks in nursing homes, that you would happily release that. There's special action in court, and a judge could rule tomorrow, but the private attorney that the state hired has said if the judge rules in favor of the media outlets and against the state, the first thing that he may do is to ask for a stay. So are you going to keep your word and happily release that, or would you ask to appeal if the state loses and the judge rules in favor of the media outlets to release the information?
We're not going to comment on something that's in front of the court.
Okay, then can I ask one other question for you? Real quick. Why is the state hiring 2 private law firms to defend you and not using the Attorney General, which would be free? You went out, and this is costing taxpayers additional, it's costing taxpayers additional dollars, and at the same time, the Centers for Medicaid Services may release this on the federal level. So if they're going to release it on the federal level, why are you fighting this, and why did you hire private firms when the Attorney General's office could have done this for free?
And again, I can't comment on something
We're not
that's in
going to
front
talk
of the
about something that's in front of the court. We'll let the court decide.
You could talk about why you're spending tax dollars on this and not hiring the
It's in
Attorney
front of the
General.
court. There's going to be no comment.
We're going to go to the Zoom board next. First, we're going to go to Jeremy Duda from the Arizona Mirror. Jeremy, go ahead. Jeremy, you may have to unmute yourself.
Oh, sorry about that. On the Department of Health Services COVID dashboard, you guys have demographic info on race and ethnicity, but a lot of that's unknown. About 26% of that right now is unknown. Why is there such a large percentage of unknown information there? And based on that, how can you be sure that resources are being directed to the communities that need them most?
That's a great question. Thanks, Jeremy. So it depends on how those lab reports come in. So a lot of times we will get electronic lab reporting that comes directly from a laboratory who may not know the race or ethnicity of that patient. It is left blank. They will get filled in if the county health departments investigate that case and go back and fill it in. But it doesn't always get filled in. That's something that we're working to educate our providers, to educate our laboratories on, that information is very important.
So we'll come back to the room here to Matt. We'll talk
Governor, I know you talked about youth sports today. You said you wish it was the MLB and the Diamondbacks, but I do want to ask you a question about pro sports, kind of a piggyback of Howie's question. In Texas today, the governor had a proclamation that said outdoor sporting facilities can have 25% capacity. I know Texas is Texas and Arizona is Arizona, but you're close with the Bidwells. You're probably talking about the NFL season, if there will be one, if there will be fans. Can you tell us what those conversations are like? I mean, are you optimistic?
Well, thank you, Matt, for the question. I would say, now, we were the first to say that pro sports could come back, and before you have fans, you've got to have players playing. So we would love to see that. And I know that's more up to the players and the owners from a professional standpoint. Our first pitch in Arizona is going to be in a Little League game. In terms of what the conversations are, they're hopeful. They're optimistic. I mean, I think it's responsible that our first thought every day is around the public health crisis that we have in Arizona. You can see from where our numbers are, we have our arms around it in terms of a spike or a way that where the system would be overwhelmed. That's not what we see right now. So we want to plan ahead, both for what could change, but also for what could go back to normal or to that temporary normal that I've talked about before. So the decision's going to be up to the NFL if they're going to play those games. We've already determined that they can. I think the home opener is August 28th. Here in Arizona. I think there's a couple of exhibition games before that. Now, Howie asked a question about something that's going to happen in July, and I said that's light years away in terms of the change that we say week to week and going from phase 1 to phase 2 to eventually phase 3. And the August date for the NFL is even beyond that. So I would only be guessing right now to talk about that, or what public health would say would be within the boundaries for fan attendance. In addition, we're right now still testing folks that believe that they've been exposed to COVID. Our supply chain's caught up. We're doing thousands and thousands of more tests. We have more accurate serology tests, which tell someone if they've contracted it and since recovered. So we should know so much more about where it's safe and who has that capacity between now and the August-September timeframe. Anything to add to that, Director?
I do have a quick follow-up for Dr. Chris, though. This is about schools. You had mentioned it before when you were explaining maybe not interacting with lunches. Does that mean lunches in classrooms, no more lunchroom, no more socializing like that?
So it could mean lunches in classrooms with the cohort of children that they're with all day. It could mean going to the lunchroom and having a shorter lunch period, cleaning up, disinfecting, and letting the next classroom in. But it is going to mean less mixing between classrooms.
Is that going to be district by district decision?
Yeah, that'll be district by district and circumstance by circumstance.
We're going to go to Antonia, and then we'll come back here.
I have a couple questions. I'll start with the governor. I'm wondering if you have any idea about party halls, when those might be.
So, Antonia, the questions are around party halls. I don't have an answer in terms of when they'll open up. Are you talking about like a specific gathering, like a reception?
Yeah. Exactly. There's our viewers love having quinceañeras, for example.
Sure. So I would say, and I want to defer to Dr. Christ on this, I think that in terms of social gatherings, where we are right now, it's around groups of 10 or less. When we get to phase 2, that number expands to 50. We're not in phase 2 yet. We're very close. We're headed in the right direction. So it's going to continue to be this idea around social distancing. I attended a wedding this past week, but it was a much smaller invite list than what was originally intended. We're hopeful that in the next several weeks, those things can change. Those halls today could open. It would just be how many people within the guidance could be invited.
Okay. And then my next question is for Dr. Chris. We saw the big crowds over Memorial Day weekend. Is it a good idea to suggest a self-quarantine if you were exposed to big crowds of people?
So we would recommend to every Arizonan to take precautions. So if you start to develop symptoms, stay home. Stay home if you're sick. Make sure that you are washing your hands frequently, that if you are going out where you can't physically distance, that you should wear a mask so that you can prevent transmission. And we wouldn't recommend necessarily self-quarantining just because you've been in a group, but we would definitely recommend that you watch for symptoms that are consistent with COVID.
Thank you. And just a last question. With the youth sports, I know you mentioned guidelines. Any idea when those become available?
So those should be available today. And they will contain a lot of recommendations for our parents, for our coaches, and as well for the participants.
Okay, and the number or any info on people who have recovered from COVID?
So we are still looking at the recovered. We've been doing a lot of work on that. We think we are close. There is no national definition of recovered. So when we reached out to Johns Hopkins, they're doing an algorithm, and they couldn't share the algorithm with us. We've reached out to some other states that do a recovered, and they just said, well, we anticipate that about 20% aren't recovered, so we do that. In the purest sense, you could take the total number of cases minus like who has died, but we don't think that that's accurate either. So we're looking at something that's a little bit more technical and case-based, but we're hoping to get that out soon.
Thank you. What Dennis next?
Some clarification from the governor. You said that a minute ago that we're still in phase 1, but bars are open, schools are reopening. That's all phase 2 kind of thing. Could you explain how you say we're still in phase 1 when it appears maybe you've de facto moved us to the next phase?
We're in phase 1 in the state of Arizona. It's a good question. The guidelines from the Centers for Disease Control and the White House give you measurements around the cases inside the state and the direction of the cases, the symptoms that you see in the state, and then hospital capacity. And they give flexibility to governors. The flexibility can be done county by county, or it can be done statewide. We are looking, when you say, you use the word a bar or a pub or nightclub or a dining hall or party hall. We've tried to focus on places that have dine-in capacity. Those are what has been reopened, and we have the flexibility at this point in time because we do have some summer school and youth leagues that are ready to begin. They need clarity on direction, and the direction is that they can begin and they can open.
Clubs in, say, Scottsdale has dining capacity.
I don't go to the clubs in Scottsdale, so you're going to have to ask somebody who's got more information on that.
But you saw the images of that. It seems like a lot of
And again, I
bars
want to
are
say to the
reopening.
people
That's
of
a phase
Arizona, thank you for your good, responsible behavior.
do
We
you have a
wouldn't
message?
have these numbers if people weren't being responsible.
I've got one more follow-up question for schools, though. It's just, with them reopening, what does that mean for schools that have year-round schools like Chandler?
So Chandler starts at the end of July. My kiddos are in the Chandler Public School District. And so what we want to be able to do is to give them time to plan so that they can be open at the end of July.
Go ahead, Michael.
So yeah, that's kind of a follow-up. I mean, you say that we're light years away when it comes to things like, sports and, even the rodeo, but why make the decision right now when it comes to schools reopening in the fall?
So when I say light years away, I don't want to be misunderstood. It means of the change that we happen week to week. So when you're asking me or Dr. Christ or General McGuire to speculate on something that's going to happen in July, August, or September when it's May, what I'm saying is that would be a guess. We have schools that are starting up in July and summer schools that are starting up next week. We're saying we're good to go on that. What I said about the rodeo is that you can have a rodeo. I didn't make any comment around the fans or the stands.
But when it comes to schools reopening potentially in the fall, and it sounds like you guys are going to have a similar type guideline, for the fall. I mean, how much could that change? Because we don't know what the numbers will look like 2 weeks from now, let alone 2 months from now.
That's a public health decision in terms of opening the schools, and that's the decision that's been made. Do you want to comment on that from the public health perspective?
So there's a lot of public health reasons why we would want kids in school. They provide a lot more services than just education. We know, based on our experience with the child care programs that are open, that there are responsible ways that you can do this, and we need kids back in the classroom.
So why are you guys deciding this now instead of waiting to see those numbers, a little
Because we
bit?
have to plan ahead, because we need parents and teachers and superintendents to be prepared. We also want to be thankful to President Michael Crow and President Bobby Robbins, who are talking about kids, college kids returning to the classroom as well. And I think 2/3 of the 700 individuals in higher ed have already made that commitment as well to the fall.
We're going to go to some of them ask the question. We'll go to Melissa first. So wrap it up.
Good afternoon. So my question is about DES. Obviously, the Department of Health Services has a dashboard where they update people on a daily basis, providing some transparency and accountability about how the coronavirus situation is going. From our viewers, we're hearing a lot of confusion, not only about how the process works, but how the state's improving. So would you be willing, or why don't you, put up some sort of dashboard or daily updates about number of calls taken, number of claims approved, number hold times for calls, number of cases that are actually kind of in dispute or being investigated? Would you do that to give Arizonans a better idea of what DES is doing on a daily basis to improve?
So the first focus right now, Melissa, is to get out benefits to people that need it. Like I said, there's been over 700,000 Arizonans who have been displaced. The department has worked very hard, and the men and women in that department have been working overtime, weekends, and holidays to get that done. In terms of some type of dashboard beyond that, we're very hopeful as we reopen our economy, we're going to be moving people off the unemployment rolls and onto the employment rolls. But we also look at this as an opportunity to make DES more user-friendly, to take better advantage of technology. I want to say this the right way, but unemployment wasn't something that was a concern over the last 6 years. Arizona's been among the fastest growing states in the nation. We've had more jobs available than we've had people to fill them. We went from an average number of folks that were on the rolls and falling off the rolls for 6 years, and then all of a sudden 700,000 claims within a couple months. So yes, we can work on a dashboard. Priority one is to make sure nobody falls through the cracks.
My question's regarding schools. A lot of them are already struggling financially. Are there any plans to provide them more, funding to be able to implement things like social distancing, to buy hand sanitizer, these types of things to keep students safe when the new school year begins?
Thank you, Giselda. That was definitely part of the discussion that we had with the superintendents is what were the needs of the schools, how would we work on flexibility for people with that underlying health condition, and what the cost would be. So part of the reason that we distributed all the state and federal dollars to our local municipalities were to deal with the situation of COVID-19. We're getting a real handle on where we are in terms of state revenues. We've not spent all the federal dollars at this time. We also have education dollars that came to the state that provide flexibility in addition to our state budget on top of our rainy day fund. So we do have some options, and we'll want to make the proper decision so that we can successfully reopen our schools in a safe way for our kids, our teachers, their staff, and employees.
Okay, thank you.
To wrap it up here, we'll go back to Howard.
Dr. Chris, I just want to make sure, you said in terms of reopening schools that they provide a lot more than just education, which sounds like you're making a balancing test that what they provide outweighs the risk of all these kids together. Are we essentially saying the benefits of kids in school outweighs the risk of having the kids together and bringing disease home to their parents?
So what we're saying is that from a public health perspective, schools provide nutrition, they provide safe environments, they provide physical activity. All of this is important for the ongoing health of these kids, especially as they grow. And so we are looking at it from a holistic public health approach. We are weighing it against the risk of transmission of the virus, and that's one of the things that we're taking into account with the flexibility is those kids that may have family members that are high risk, and how do we account to keep them safe while we're still meeting the needs of the children.
We'll do one more from Michael, and we'll wrap it up with the other Michael.
I know this is a little bit out. President Trump tweeted about 12 minutes ago that Valley Metro is getting $100 million for the light rail. I was hoping to get your comments on that as well.
I haven't seen the tweet.
It says, very exciting news for the Phoenix area. Department of Transportation is committing $100 million to the Valley Metro for a 5.5-mile light rail system with 9 new stations connecting underserved areas to churches, emergency services, and more.
Well, if we've got federal dollars coming to help grow the state and transportation infrastructure, I can't say anything except that that's a good thing.
Governor, just real quick on the subject, so Trump, which is, the president has said that mail voting is subject to fraud, it cheats people. We have something like 80% of Arizonans who vote by mail. What's your thought on mail voting?
I think in Arizona, we've done a very good job on making it easy to vote and hard to cheat. And I think it's important as people expand the options in their own election system, that they make sure that there are safeguards there. And I'm proud of the elections that we've been able to run in the state of Arizona, the options that we provide our citizens in the state. In our state, we're going to work overtime to make certain that no citizen is disenfranchised from their vote. In closing, I want to say thank you, everyone, for your time. Thanks to all the Arizonans that are working so hard and behaving so responsibly. I want to say a special thank you to General McGuire and what he and the Guard have done, and Dr. Christ for your hard work. I'm excited for our new director at Department of Economic Security. I'm thankful to Tom Betlak. And if you're looking for a headline, it would be that play ball is going to happen with Arizona Little League, and that get ready for school in the upcoming year. Thank you.
All right, you have just been listening to Governor Doug Ducey give his latest press conference in regards to coronavirus issues. There are 4 big takeaways that you should get out of that news conference. First up, there are plenty of hospital beds, ICU beds, as well as ventilators available in case there is a surge in coronavirus cases. Also, the second big takeaway here when it comes to schools, it will resume at the start of the school year, but this is going to be more of a new normal, and there are flexible guidance suggestions. So this could mean anything from reduced class sizes, more disinfecting. Those who are vulnerable health-wise can still do some distance learning, no big assemblies, lunches in classrooms, or even shorter lunches. But this is going to be determined by district, and it's going to be determined by circumstance. State Superintendent Kathy Hoffman will be releasing guidance on this coming up on Monday, June 1st. Also, the third big takeaway when it comes to organized youth activities, that can resume. However, there is some suggested guidance on that, such as limiting the number of people at these events, no sharing drinks or snacks, and of course, disinfecting equipment. Of course, more guidance to be released. And finally, the fourth big takeaway on this.
19, 18, 19, nothing.